But then we go into a really important area, and this is endocrine. And I'm gonna make an assumption. We're gonna talk about pancreas a little bit when we get to the belly, and I'll kind of throw in a little diabetic moment there when we talk about the head and tail of the pancreas. But I thought we better right here have a moment about the thyroid and the adrenals. Okay, and kind of focus there. And the two I'm going to focus on are myxedema and Cushing's, the two outside characters here. And these are usually aging women. So let's take a look at what we're talking about. We're talking about the thyroid not functioning, and we're talking about the adrenal cortex overfunctioning. So those are the two situations that we have. Now with aging women, this is happening because of stress, the adrenal cortex. This is happening just with age and probably an old beaten up thyroid. And what we found out is that Hashimoto and myxedema are both autoimmune diseases, one primary, one secondary, but they're both autoimmune diseases beating up the thyroid. And so we're doing it with our own environment as we see this increase. So we're causing our own demise, and what do you think about stress? So these are kind of man and woman made, so to speak. So when we look at this then, I want you to kind of be able to think about why both of these patients would come to your office. She's older, her life's, been through quite a few things here. She's starting to put on some pounds, but that's both of these ladies putting on weight, and they're swollen. So they came to you because of peripheral nerve entrapment. So they have burning in their hands, the back of their calves, down their legs. Now there's a third player here that I want you to think of. When somebody's got multiple burning extremities, and it's a woman, I want you to think of three things. I want you to think of Cushing's, I want you to think of myxedema, Hashimoto, that club, and I also want you to think of your diabetic. Okay, and those are your three that often are, and write them down again: diabetes, Cushing's, myxedema. That's kind of the big three. I'll say it another way: diabetes type 2, hyperadrenal-corticalism, hypothyroidism. Got it? Okay, now those people complain of polyneuropathies or burning in multiple hands, feet, extremities. So how do we tell them apart? Well, the diabetic is going to have polydipsia, polyuria, polyphagia. So that's your polys. There are three. That's your questions. When you're talking about the myxedema patient, everything in their body's slowing down because it controls their basal metabolic rate. So you're going to find they have constipation, they have cat naps, they're sleeping in, those kinds of things. But they do get swelling around their eyes, periorbital swelling, which means that they get this great big, kind of big bushy eyebrow in the middle, and then this out here kind of looks like a little tail and almost nothing out here in the lateral third. So they often draw their eyebrows in the color they used to be badly, is my joke about it, but that's periorbital or enophthalmosis. This person gets a great big puffy moon face. Now the other thing that this person does is take on the male features. So that's the hirsutism, the chin hair, the chest hair, those kinds of things, the aggressive nature, short-tempered, those kinds of things. Okay, so I want you to realize then myxedema, Cushing's, and then of course diabetes we'll talk about another place. Now when it comes to the treatment of these, we can treat this gal all day long and be adjusting her and taking care of her. We want to think about whether or not iodine might be supportive. We want to talk about B6 for all the swelling in the extremities. But I want to talk to you about this lady. You see I've written the word osteoporosis right across, and over here was just, I didn't even, nothing. See, this is written across the word bone right there, but I just thought I'd just write osteoporosis in for you so you understand that when you're dealing with either Addison's or Cushing's, the treatment for this is to give them steroids. And once you've been on steroids for a long period of time, corticosteroids, you are going to get osteoporosis and your immune system is going to get trashed. So I want you to understand you have some real major concerns here that you don't have over here. So this person, if they trip, fall, take a little misstep, I'd still x-ray them. I might not x-ray her, but I x-ray her. Okay, so I want you thinking about that and realizing that you want to make sure she's on a regular adjustment scale to keep her immune system up. Those kinds of things then become very important. So some key differences then between these two patients. Well, one final note here. Obviously, if she has osteoporosis, we need to be gentle. That's why you're x-raying before any little slip of trauma. But I also want to point out, it says down here that they probably in the post-encounter probe room, the right x-ray to put in this room is a lateral skull, so that you can look at the sella turcica. But the sella turcica is not involved in any of these cases up here. And in fact, if you're going with an endocrine disease, it will probably be fine. The only endocrine disease where the cell turcisis is going to be a problem is if it's a pituitary disease, which means all the endocrine functions are going to be in a mess, and that patient's way beyond probably coming into your office. So I want you to realize if you're picking myxedema, Hashimoto, Cushing's, then the lateral cervical has a normal cella turcica on it. Okay.
Lateral skull.
The lateral skull, what'd I say?
Cervical.
Lateral cervical. Well, the lateral skull, they'll kind of show you sort of a mega picture.
Right.
Skull cervical, so it's sort of a combo thing. But anyway, anything that you can see the cell turcica on, it's going to be normal. I just got it. If the cell turcica is abnormal, then they're going to have, what are they going to have now? Tell me. Bitemporal hemianopsia. So they're going to have that problem with vision. So the visual disturbance will give away if it's the pituitary. Sorry, it just came to me and I realized I forgot to tell you. All right, we're moving into the genital area. Now, they're not going to ask you to do a breast exam or a prostate exam, right? But you have to know the results. Okay, you have to know if somebody's had one or if their parents have died from any diseases that might be linked to genital problems such as breast cancer or prostate cancer. So you do have to know all of this information. So I want you to take a look at what we've got up here. Okay, if you look at, I want you to make sure you know what all these are for, so I'm going to go through that with you, but I wanted to take a minute because I know you're already looking at it. The things I have circled up here in blue are things that really give away if it's acute, if it's chronic, if it's benign, or if it's malignant. So take a minute to highlight those, and while you're doing it, think about the fact that, yep, warm, tender, fever all give away acute. That a normal digital rectal exam can only happen with chronic prostatitis or a normal prostate. And boggy and peeing a lot at night gives away BPH all the time. And the posterior lobe and the nodules, the lumpy bumpy, are going to give away, of course, cancer. Now, a PSA is normal if it's below 4. If it's above 4, though, it can be 22, 632, or 1,000. And it still doesn't tell you how bad the cancer is, or if it's spread, or if it's, so you really don't know when it's elevated if you're dealing with chronic prostatitis, BPH, or really bad cancer, or how bad the cancer is. So just a PSA above 4 tells us something's wrong, we should be evaluating it, and then if you do have cancer, we can use it to kind of tell if what you're doing is moving in the right or wrong direction. So it has great value, but it's not specific for what disease do you have. Now, acid phos is in every single prostate. So when a prostate squeezes with ejaculation, you release some. But if it has cancer, you release some. If it's irritated by infection, you release some. So again, not a very specific test, but it does tell us something about the prostate. Now, ALK phos is only valuable for the fact that you're making bone. But remember, most cancer that spreads is lytic metastasis. But prostate cancer, when it spreads, is blastic. So you might have an increase in calcium, but you would have an increase in ALK phos, which tells us blastic mets. So that's important that we link that here. The digital exam is what all of this is about, which makes it one of the best and most important tests for a man over 50 to have done annually. And then cystometric is if he's having trouble voiding, then they'll do that with the urologist or the oncologist. Either one can do that, or even most primary doctors don't have that in their office. But remember, you void, we measure it, and then do the ultrasound to see if your bladder indeed has empty. Now, as we raise this up and we move into the breast exam, remember both men and women should be evaluating their chest or breast tissue. That men can get breast cancer as well as women, especially with sort of our onslaught of hormones in all of our meats and foods that are out there. We find that gynecomastia or excessive breast tissue in some men is becoming quite abundant out there. And I didn't mean a pun on that, but you get the idea. Now, the lymph, okay, the axillary lymph nodes are really key to this because a lot of cancer happens up here in the tail of Spence, remember that? So it's really important that everybody's taught how to evaluate all that tissue that's up in there. So this just takes you through the inspection and the evaluation and palpation, and I just wanted to make sure that was in there because it's such an important thing. Even if it's not on your test, I wanted you to have it. Now, when we talk about a female, the mammogram evaluating the breast, the pap smear is going to be from the cervix and the tissue around it in the vaginal tissue. The laparoscopy and colonoscopy are just evaluating kind of the tummy area and sort of all those lower parts of her. The culture can be for any infection, mastitis, vaginitis, salpingitis, any of those. Biopsy is going to confirm if something's malignant. Remember, the word PET is for soft tissue cancers, so that's going to tell us about lymph and breast cancers because they go through ducts and channels. And then functional MRI, whenever they put an F in front of MRI like that, it means that they've either done it in different positions or they put a dye in to look for a certain a kind of function that's going on. So those are sort of the key words there. Now I put the female breast issues up here and then the female kind of uterine issues down here. So when we're talking about breast, probably the key one up here is breast cancer. All of you know, I hope, that if they take all the breast out, there are still breast cells left in someone. So it can always reoccur. Breast cancer can always reoccur. It's still an issue even after a complete removal, or so they say. Now the word Paget's, most of our mind goes to bone, right? But Paget's is a rare form of breast cancer that usually kind of it's a nipple cancer is what it is, kind of underneath the nipple. So realize that word might show up as a third answer or something, and you're not making sense out of it. They're probably referring to breast cancer. Now the other thing that has showed up quite regularly is the pregnancy. But she's going to come in with low back pain and see if you're going to kind of go off on Facet syndrome or something else. Make sure that any woman that's in childbearing years that you think has low back pain, that you've ruled out, is she sexually active or when was her last menstrual cycle, rule out that you think this is related to any kind of pregnancy. Because the right things that kind of show up are, she'll start to talk about that she has nausea in the morning. That's the key one they kind of drop in there to see if then you're going to ask about, you know, the last menstrual cycle and could she be pregnant, those kinds of things. The other thing they've asked are the complications to that, and that would be things like the fact that the ectopic pregnancy, you know, it could burst, the ruptured tubal pregnancy, and maybe the other thing is that it does turn into a calcification or some kind of cancer or malignancy instead of turning out normal. Remember the hydatidiform and the choriocarcinoma, those things can happen. The other more common thing to happen to women is to get endometriosis, which is going to cause the irregular periods and the lack of organization and the trouble getting pregnant. So she's to have her children earlier than later.